This video might be the most important video for you to solve your back pain. And it's important because it tends to be the most confused, misunderstood component of solving back pain. So pay attention, because this is your pathway to freedom from back pain. The confusion is about the source of the pain and the cause of the pain. Because if you treat the source, but you don't treat the cause, the pain doesn't go away, or it goes away for a little bit and then it comes back. So this is all about the source and the cause. When you have back pain, it's not going away. The source very often is the disc. It's the disc, sometimes it's the end plate of the bone, sometimes it's the facet joint, there's a little bit of arthritis, but they're all connected. And that is the source. And when we talk about the source, we focus on the words associated with the source of your pain. The bulging disc, the herniated disc, the degenerated disc, all those things. But most treatments for back pain treat the source and not the cause. And if you don't treat the underlying cause, the back pain won't go away. Because the underlying cause needs to be addressed in order to solve why you have the source. I'm trying not to make this too confusing. So if you've had back pain and you've not gotten better, or the pain always came back, or you've tried a lot of different treatments, the problem is it was too much focus on the source. Now, sometimes we hear the words, and the words frighten us, or they hold us back, or they limit our understanding of the problem. Again, the problem is not the disc. The disc is why you have pain, but the question is what's causing the disc problem? Because then you treat the cause of the disc problem, the pain goes away. So it doesn't matter what you call it. You can call it herniated disc, bulging disc, degenerated disc, or degenerative disc disease, because that sounds really terrible. Stenosis, spondylolisthesis. Okay, that's a long word that's confusing and maybe frightening. Sciatica, arthritis, neuropathy, and pinched nerves, right? These are all the sources. The disc, and you have to understand the disc, and you have to understand what happens to the disc, and then you have to understand why it's happening to the disc. Because when you treat the why, the pain goes away. And again, it doesn't matter what you call it. People get very emotional about their words. Oh my gosh, I have a herniated disc and I'm gonna have it forever. Or I have a herniated disc and the doctor said I have to live with it. It's not the herniated disc. The herniated disc causes the pain. The herniated disc is the source of the pain. The cause is the underlying dysfunction. And this entire process, and this entire breakthrough for back pain treatment is all about treating the cause. We don't care what you call it. Some people don't understand that. Why don't you care? Because the cause is why you have the source. And the source has many different names, but the cause is always the same. And when you address the cause, you will get better. So let's talk a little bit about the disc, then you can understand the source, and then we'll talk about what causes the source. Because There's 5 components to the cause, and when you address those components, the source of the pain goes away. That's the key. That's the breakthrough. That's why you can all get better. So what do we know? One vertebrae on top of the other. Looks like this. One vertebrae on top of the other. The disc is in between. The disc is like a jelly donut in the sense that the outside of the disc, I have my golf club here. The outside of the disc, there is a thick material. We call that the annulus. The annulus is made of cartilage. It's thick. It's very durable. It's resilient, but it can break down when things aren't working the way they should. And the working the way they should is what our goal is for you. Working the way it should is the cause. So we know that the disc, annulus on the outside, nucleus on the inside. The nucleus is a jelly. It's designed to distribute stresses evenly in all directions on the annulus. What can happen? Cause. Stresses can be distributed unevenly, abnormally, frequently, more than necessary, more than it can tolerate. And what happens is the nucleus will start to push in one direction. As it starts to push, it'll start to cause an inflammatory process on the annulus. The inflammatory process will start to cause you pain, thus the source. So it can be bulging, it can be degenerated, it can be herniated. It's the inflammatory process in the annulus as a result of repetitive loads, abnormal loads, movement patterns that are dysfunctional. All these things will overload the disc. The inflammatory process in the disc will create pain, but inflammation also creates a weakness. The tissues get weaker. They're less stable. They're less resilient. And as it gets weaker and more painful, you'll start to develop little tears. And those little tears in the annulus will cause the nucleus to start to push out. Source of the pain. Source of the pain. Nucleus pushes out through the tear. Too much inflammation causes pain. Pushes out further. Bulging disc. Herniated disc. If it breaks down further, it can cause the degenerated disc. Okay? The degenerated disc is the source. Not the cause. Arthritis will also be a result of the breakdown process. That is the source. It's not the cause, but it's all part of the same cycle. It's called the degenerative cycle. Once the disc starts to break down, if you don't solve the cause, the disc continues to break down. So the question is, what is the cause? We know the source is the disc, is the facet joint, is the inflammatory process, source of pain. That's why you have the pain. What causes the pain? We know that with motion, and this was the breakthrough, this is why you can get out of pain. Doesn't matter what the problem is. When you get this part, your life gets better, because then you can make better decisions about how to manage your problem. But what we identified with the motion patterns of the spine is the disc can start to move. And it has everything to do with that tear. When you move in ways that you shouldn't be moving, the disc starts to break down. And then this repetitive motion on this weakened disc tends to make things worse. Now, we also have talked about inhibition of the muscles. What causes the inhibition? Well, we know that sitting causes lower cross syndrome, and we sit more now than ever. But we also know instability will cause a decrease of nervous system flow to the muscles, and you'll actually start to get atrophy. We talked about ankle injuries can actually inhibit the gluteus medius. So the inhibition, the inability for the muscles to work the way they should and or have the necessary strength to do the activities that they're designed to do, results in the wear and tear. You don't have wear and tear because you run too much, or you swim too much, or you ride your bike too much, or you hike too much. You have wear and tear because the muscles have gone out of balance, and then the tissues aren't supporting the spine the way they should, or the muscles are not supporting the spine the way they should, and you develop the wear and tear. And when you have wear and tear, you're not supposed to stop. You need to reactivate. So by stopping, you actually make it worse. So when you hear the word wear and tear, you have wear and tear because the system is not working the way it should. You're having a breakdown in the system. It's called the dysfunctional continuum. We've talked about the functional continuum. This is where the dysfunction starts and it progresses. And as it progresses, things break down even more, creating more source. This is the cause. It's a change in the functional continuum, the way things work together. It's a 5-part process. Back pain is not one thing. Back pain is 5 things, and you have to solve all 5. So we know that it can happen from old injuries, sitting too long, instability, nervous system dysfunction, and then you start to move in ways that are not proper. There's a proper way to move and a dysfunctional way to move. So very often what happens is you can develop an inhibition where the muscles don't work the way they should. And then when the muscles don't work the way they should, you develop abnormal movement patterns. And the biggest problem that we have is muscles get weak. We start to use our spine to bend, especially if if you sit too long, you'll start to use the spine to bend. And when you start to use the spine to bend, you'll aggravate the disc. Okay? So it starts with inhibition, and then you'll develop abnormal movement patterns, and the sitting will actually cause the vertebrae to become slightly unstable. We know that an unstable vertebrae will decrease the nervous system flow to the muscles, which will actually cause the atrophy, and you'll get muscle inhibition, starts to affect the erectors, and then it starts to affect the obliques, then it starts to affect the hips, and you can have the old injuries that affects all those muscles, and then you get a decrease in hip motion. Hips get tight. If you have chronic back pain, you very often have really tight hips. Okay, the tight hips have sort of progressed and evolved that way as a result of all the dysfunction, and then you get more weak glutes. And the problem is, once this cycle starts, it continues. And if you don't address the cycle and you only address the source, you will not get better. Every person I talk to, I tried treatments and I didn't get better. Well, because they weren't addressing the cause. They were addressing the source. The source of your pain isn't the cause. You have to address the cause. There's no other way around it. There's no magic solution. There's no magic pill. There's no magic formula. There's no magic laser. There's no magic PRP. There's no magic stem cells. This is the cause. This is the only cause. Okay, there's different sources, but the sources are all a result of the cause. It's this repetitive motion over the disc that causes the disc to break down. Again, it's 5 process. If you're bending all day long, you're going to aggravate that disc. Okay? And then you're going to start to aggravate the facet joints, which is going to cause a little bit of arthritis. And then you're going to develop a little instability where the vertebrae start to move. And then that's when the nucleus starts to push out. And then the muscles start to get weak from the inhibition. We talked about that. And then the hip motion goes way out of balance. And when the hips aren't moving the way they should, then what happens is you start to use your spine. And then the muscles get weaker. And a combination of all those will lead to the problem of the disc, the progression. The cause is the underlying dysfunction of those 5 components that's progressing the wear and tear on the disc. The wear and tear on the disc is not the result of you walking too much or running too much. It's the result of everything being out of balance, all the things that we talked about. And that will lead to the degenerated disc. This is what the degenerated disc looks like. So it's this cycle of breakdown leads to all this. Now there's a way to get out of this. This is our program. This is the only way out. It takes time, it takes effort, but this is how you get out. This is how you get out of your herniated disc. Okay, don't get caught up in the words. People are, oh my, I have a herniated disc, or I have stenosis. Oh my gosh, I have these terrible things going on. I have a degenerative disc disease. You don't have a disease. You have a dysfunction. You treat the cause, the source goes away. That's how it works. Move well. Move well. There's a way to move well. We teach you how to move well. And then you strengthen all the muscles that help you move well. Sometimes you can't move well because the muscles are weak. Move well, create stability, create endurance, restore motion to the hips, restore strength. It takes the entire process and progresses. It doesn't matter what we call it. People are more attached to the word and don't address the cause. It's the one thing I see all the time. Address the cause, eliminate the source. That's how it works. It's the continuum. Okay? The dysfunctional continuum is the breakdown. The functional continuum is the build up. And the only way to do that is to strengthen the muscles that help you to move well. That eliminates the problem. It sounds so easy. It takes effort, but you can get better. It takes time, but you can get better. So pain relief is weakness leaving the body. What does that mean? It means you get stronger. It's the way out. The way out is to get stronger. Treat the cause, not the source. The reason other treatments don't work is they're focused on the source, not the cause. Do the work and you can get better. This is our program. We have a program called 10X. It walks you through all the components. It's the most comprehensive scientific program available. Took 30 years to develop. But when you get it, you get your life back. I had it. I struggled. It's a week by week progressive exercise program that specifically targets the cause. It's the only one like it on the planet, and it's the best. It works. $47 a month. If you want the program, you go to totalbackpainrelief.com, 10x order 1. We can help you get your life back. Don't focus on the source, focus on the cause. Welcome to the program. We're here to help you get your life back. 10x order, total back pain relief. That's it.